My name is Melissa Koenig, and I'm a physiotherapist here at Craven Sport Services and the manager of third-party insurance coverage. I'm here today to walk you through the diverse treatment options that physiotherapy can provide to you if you've experienced a car accident on any scale. As we will review with you today, physiotherapists are here to help you manage any new injuries, aches, or pains sustained in a motor vehicle accident with care, compassion, and ease. In the days or weeks following a car accident, you may start to develop aches and pains in your body. An assessment with a physiotherapist can be helpful to determine different treatment options that will help you to resolve and recover from injuries sustained in a motor vehicle accident. Physiotherapy care following a motor vehicle accident will include a conversation with your therapist about your medical history, obtaining details of the crash, and a discussion of the symptoms that you've been experiencing. In addition, the physiotherapist will observe how you move, as well as provide some hands-on treatment, and discuss lifestyle modifications, stretches, or exercises to aid in your recovery. Physiotherapists can screen patients having been in a motor vehicle accident for common injuries including whiplash, sprains, dislocations, and concussions. More on that in a minute. Physiotherapists can be part of your larger post-accident care team. We can communicate with any other treating practitioners, including physicians, massage therapists, chiropractors, or specialists who are assisting in your recovery.
Hi, I'm Lee Stevens, Manager of Concussion Management at Craven Sport Services. In addition to the more obvious soft tissue injuries that can result from a car accident, concussions are another common injury that can result from both major and minor motor vehicle collisions. A common misconception is that a person needs to have hit their head during a collision in order for a concussion to occur. While this certainly can be the case, they can also happen without direct contact, such as when your vehicle and head come to a sudden stop or change of direction, causing the brain to accelerate and decelerate quickly within the skull. In this way, concussions and whiplash are closely linked and can often happen simultaneously. Physiotherapy plays an important role in developing a corresponding treatment approach to reflect this. Physiotherapists are trained to monitor for signs and symptoms that may indicate a concussion. This can include headache, nausea, dizziness, sensitivity to light or noise, difficulty concentrating, increased fatigue, as well as many others. Every individual with a concussion is going to present differently, so it's important that the assessment be comprehensive and include screening and examination of the various systems that can be affected by a concussion. This will allow for the development of an individualized physiotherapy plan that may include a combination of education, graded aerobic exercise, biomechanical treatment, vestibular and balance rehabilitation, and visual retraining. Guidance regarding appropriate progression of activity levels, as well as how and when to successfully integrate back into work and school, is another very important part of the concussion recovery process. Ruling out concussions and providing targeted rehabilitation strategies when necessary is a critical component of post-accident care. Your physiotherapist is there for you to help you navigate the process and ensure that your treatment plan is timely, appropriate, and effective so that you recover as fast as possible and with the fewest complications. Now back to you, Melissa.
Navigating the days, weeks, and even months after a car accident can be stressful and confusing. You'll potentially be dealing with damages incurred to your vehicle itself, but most importantly, working hard to get your body back to feeling itself again. For many reasons, a physiotherapist can be an important resource in assisting you through this process. Firstly, making the right decisions at the right time. Following an injury, including motor vehicle accidents, it can be challenging to know how and when to phase back into the activities you love. Whether these activities include long walks with the dogs, organized sports, yoga classes, or the various components of an active lifestyle, physiotherapists can help reintroduce you safely into the hobbies and activities that matter to you. Secondly, physiotherapists can screen for injuries or concerns. Regardless of whether an injury is caused by a motor vehicle accident or another form of trauma, a physiotherapist is well trained to screen for a wide range of potential injuries or concerns that may exist beneath the surface. From concussions, whiplash, dislocations, nerve compression, and more, a physiotherapist is an important part of your medical team and well trained to identify and support the management of such injuries. Thirdly, physiotherapists help take out the guesswork. A physiotherapist can help take out the guesswork following an injury. Why does my neck hurt when I turn my head, you may ask? What's going on with my hips? Is it normal for my back to feel this way? Physiotherapists are trained professionals who have spent years answering these exact questions. Education is a huge part of the physiotherapy treatment, and your therapist will ensure you fully understand the why behind any new aches, pains, or sensations, as well as how to best manage them. Moreover, the source of the pain isn't always the source of the problem, and every body is different. Physiotherapists take out the guesswork and let you focus on what needs to happen in order to feel like yourself again. Sometimes it's okay to leave Dr. Google out of the equation. So there you have it. Physiotherapy can assist in the management of any injuries and follow-up care needed after an accident in many different ways. Physiotherapists are trained medical professionals who are dedicated to assisting you in getting stronger, more mobile, and feeling like yourself again. For more information or to book an appointment with one of the members of our team, call the clinic at 306-934-2011.